Foundation Liver Transplant Program, and I invite a few dignitaries on the dais to grace the evening. Dr. Parvez Grant, our Managing Trustee, Chief Cardiologist, Dr. R. V. Gulati sir, our Trustee, Founder of the Coronary Care Unit, mentor, visionary, and a critic for all the wrongdoings that we have done. I also invite Dr. Rela on stage. I also invite a person who is known to all of us, but maybe not seen well enough, is Mr. Praveen Agarwal. He is the chairman of the Sterlite Industries, and more than a hat of industrialist that he's wearing, he is a great philanthropist. For the reason being, he supports the Praveen Agarwal Foundation, which has done more than 100 crores of charity towards supporting the liver program for children, and has done over 100 liver transplants supported by his funding. Please give him a warm welcome. Any transplant program doesn't purely run on a team of doctors, but there is a larger ecosystem from which we derive strength and courage, and it's philanthropy, it's social service, it's awareness, and all of us are part of this journey. To introduce this evening, I invite Dr. Manisha Karmarkar, our Chief Operating Officer for Ruby Hall Vanori, to kindly come on stage and say a few words about our journey in this era. Manisha.
Good evening, dear friends, colleagues, and dignitaries on the dais. It is indeed an honor and privilege to welcome one and all on this occasion of the inauguration of the multi-organ transplant program today. The official inauguration of this program was done this morning at our super speciality building at the hands of Dr. Rela. Professor Rela is a very well-known, renowned liver transplant surgeon who has done more than 5,000 liver surgeries to his credit. He is also a pioneer of liver transplant surgery with over 3 decades of experience. Ladies and gentlemen, many may not know, but he is featured in the Guinness Book of World Records in 2000 for carrying out a liver transplant on a 5-day-old baby who is now a young, fit law student. He has successfully conducted liver transplant surgeries right from a 5-month-old child to a 70-year-old adult with a success rate of more than 90%. This itself speaks volumes about his expertise. I have been interacting with Professor Rela since morning, and he's a very humble and a down-to-earth person, and it's really heartwarming to know that a surgeon of such a caliber can be so humble. He has also mentored and pioneered liver transplant programs in various cities like Hyderabad, Chennai, Bangalore, Mumbai, and now Pune. Professor Rela, I extend a very warm welcome to you and your entire team on behalf of Ruby Hall Clinic Parivar. And I'm sure that under your mentorship, the liver transplant program will reach new heights and will be the highlight of a multi-organ transplant program. The multi-organ transplant program was the brainchild of a very dynamic CEO, Mr. Bhumi Bode. It was under his able leadership that Ruby Hall Clinic performed its first organ donation in 1997, and we have come a long way since then. Ruby Hall Clinic has also been awarded by NOTO as the best multi-organ transplant center in the country in 2016. Mr. Bode has also conveyed his regards and wishes to all of you out here from Australia. His dream of having a comprehensive, consolidated, multi-organ transplant program is seeing reality today. I would like to mention here that a multi-organ transplant program cannot be carried out without positive attitude, understanding and cooperation of the entire medical fraternity, but also of the entire society. Today's event is a symbol of such positive attitude and understanding amongst us. And so it gives me immense pleasure to announce that the association between Professor Rela and Ruby Hall Clinic will be known as the Rela Institute at Ruby Hall Clinic. I wish this association a great success and once again welcome Dr. Rela and his entire team to this wonderful institute. Thank you.
I request Manisha to kindly felicitate our guest of honor, Dr. Rela, with a bouquet, a small token. It's the other way around. Red roses for you, Dr. Rela. Unfortunate. The same kind gesture for Mr. Agarwal. I request Dr. Parvez to say a few words.
Good evening, everybody, and welcome here today. I'm going to be quite brief because I think we are already running quite late today. But going back about nearly 12 years ago, I was sitting with my father one day, and he said, Parvez, what is going to happen in future is there'll definitely be a hospital in Pune which will start doing transplantation. And he said we should be the first doing it. And I think his dream has come true. And I'm very, very happy that today I can proudly say that we have put Ruby Hall in the transplant map of India. We're very lucky because not only do we have Dr. Rela, but we've also got Dr. Bala. So now we've got the best team for cardiac, the best team for liver, and the best team in Ruby itself, which will continue the good work. So I'm very, very proud that we've got two birds in one hand. Dr. Rela, we are very happy that you're being here with us, and we look forward to a great partnership together. And, you have to promise me that you keep coming every month. You can't just get away. Poor chap has seen 55 patients his first visit, and that's all the patients have come from far away just to be and take his advice. So I think he's just what a great man we have in front of us. I would like to thank my friend Praveen, very kind man. Whatever I ask, he gives me. So this morning I said, why don't you give us set up the first-class pediatric liver setup at Ruby Hall. And he's kindly agreed to take a full floor and develop the Praveen Agarwal Institute at Ruby Hall Clinic, which will also go a long way in fulfilling his dream of making liver transplants affordable to the pediatric group of patients. I won't say too much. I just want to say thank you, everybody, and good luck. I'm going to ask Praveen to say just 2 words because we're running late and I don't want to keep you all away from Dr. Rela and the food and the drinks.
Thank you, Parvez. Wonderful. I'm so honored this evening to be part of this event. I never thought of it that I'll be on dais. I thought I'll be on listening side, not on the saying something around. But I'm thankful to Parvez and his team to give me this honor. Friends, as Parvez said that I won't take much time as we're already late today, but before I conclude, I must say a few things which is very, very important for me this evening. Friends, the reason why many people ask me that why you initiated this liver transplant only to support, why not many other organs as far the transplants are concerned. Friends, I like to share here, I'll go back about 30 years back. And when I thought about it to, whenever the time will come, give back to the society, I thought something I should keep it in my mind. And whenever the appropriate time comes, I'll do that. So I did my small research on it. And this morning when I met Dr. Rela, I shared my research with him. And that he also, incidentally, same time when I visited Pittsburgh in 91, and Dr. Rela also visited in 91. This is a coincidence. And he mentioned about his experience because, friends, Pittsburgh is one of the first liver transplant in USA, where they did the research under Dr. Starzl. He is the pioneer of the liver transplant, and I met him personally. In those days, I took his advice, how this goes and how things can be possible in time to come. And I met a lot of doctors' team at that point in time in Pittsburgh. And then finally I took a call that whenever it's possible, I'll do something support to the liver transplant. When I did some research in India, also I found that many institutions are there as a philanthropy also and a support also. They do a lot of stuff for the kidney, they do a lot of stuff for the heart, but I haven't found many guys who did really some support to the liver. So that was my intention, that whatever little bit I can do from my end, I wanted to focus on the liver, and that's how I initiated. As Parvez already mentioned, I've already crossed 100 liver transplants in India, and few of the patients also I have helped who has come from outside India, and they have been treated in India. So this is how the journey, friends. I also like to share that Dr. Rela's Institute in Chennai, I have supported already 6 patients under his supervision. So that is my pleasure and my initiative in this area. Also, friends, that one more thing I like to share, that I plan to continue my dialogue with Ruby and Dr. Rela to explore further area of mutual interest, whatever we can do in Pune in Ruby Hall. There is a lot of synergy I can see, look into, pool resources and be a participants to a new area of improved cooperation for liver disease management. Thank you, friends.
Thank you, Mr. Agarwal sir. I think we are extremely grateful and very happy to be associated with the foundation. Really, I think Parvez is like a magnet. He attracts the best of the world. And now I move on to Dr. Gulati, our trustee, to say a few words about our journey in this era.
Dr. Mohamed Rela, and I must recognize his team also who have come from Chennai, Dr. Elan, Dr. Rajesh, Mr. Farooq, Parviz Grant, Mr. Praveen Agarwal, and my own team from Pune, who was now going into the liver transplant program. Collaboration is a process of 2 or more people and 2 or more organizations working together to complete a task and or achieve a much higher goal. All collaborations need leadership, like-minded individuals, fully trained personnel, and above all, great sincerity, loyalty, hard work, and dedication to their task. Today you have seen this great collaboration at work. Dr. Mohamed Rela and his team, plus the team of Ruby Hall, how they have toiled for 6 long hours during a very complex surgery, and then of course given their time for seeing a number and a host of OPD patients. I admire surgeons. I admire Dr. Rela. I see his stamina. Started from Chennai this morning, straight to meet us all from the airport. Finished formalities of inauguration of the multi-center transplant center, a press conference, and then into surgery. Then another 50 patients. Here he is now still as fresh as ever. That's why I admire his work. Dr. Rela, you have come here to Pune in the holy week of Maharathtra. It's a great blessing to us and a great blessing to the medical community of Pune. I am sure that this collaboration is going to flourish and it will go on and on and on. One question to my audience: how many of you have Googled today liver transplant in India? I did it this evening, and the first thing it said was on the 14th of August 2019, you'll correct me if I'm wrong, Dr. Rela, you weren't there. The Dr. Rela Institute and Medical Center was awarded the best liver transplant unit by the Honorable Health Minister of Tamil Nadu. After they received it on your behalf, you were busy somewhere. The Rela Institute boasts of highest quality of healthcare and life expectancy after liver transplantation. The Grant Medical Foundation and the Ruby Hall Clinic boasts of exactly the same thing, of the highest quality of medical care. And now we want that life expectancy after liver transplant goes the second half with you. He has always believed that technology bridges all the ones which are the gaps which are there, the therapeutic gaps. And he has always believed that compassion with his patients cures a patient. We also believe in that, and we welcome you this evening.
Thank you, sir, for the wisdom. I invite Nitin Pai, our colleague, Director of Gastroenterology, to really introduce who Dr. Rela is. And then he'll be followed by Manoj, who's been a student, following Nitin. Thank you.
Good evening, everyone. Welcome to our little presentation today. All dignitaries on the dais, dear friends. It's with great pride when Dr. Gulati said that did you Google somebody, and when you see that an Indian surgeon, a surgeon of Indian origin who is among the top 20 pediatric surgeons who have made impact in the world. It's a big saying of a man. Dr. Rela, you're a legend. You have pioneered liver transplant for 3 odd decades, 5,000 odd surgeries. You hold the Guinness record, Manisha has already said. It was a girl he operated in 1997 but got the record in 2000, so they were waiting for somebody to beat you probably. Born in a Mofussil town in just off Tamil Nadu near Chennai. Did his MS from Stanley in 80s, did his FRCS in 98, has been at King's from 1991. And the rest, as they say, is history. The first auxiliary, the first split, the first live donor, 3 decades, 5,000 transplants, 3 doctorates from 3 universities, 20 most innovative pediatric surgeon, heading currently a big 500-bedded unit, 250 transplants plus a year, plus mentoring many towns in Tier 2 cities all around Chennai, and also mentoring us today. Ladies and gentlemen, Dr. Rela deserves a round of applause. When he did come back to serve us back in this country, in 1999 was his first live related. He's done his first live related on an 18-month-old baby. He's done the first split in India, the first swap in India, 600 plus publications in numerous books, many chapters. For us, that is an academician and that is a teacher. They say, or at least the Modi jacket should say, Vasudeva Kutumbakam. The world is one family. He belongs to Chennai, he will be in Ruby Hall, but he belongs to all of you all also. He belongs to all of you all because he is here to serve each and every patient of yours. So Dr. Professor Rela, please. Ladies and gentlemen, I present to you Professor Rela.
Respected Dr. Gulati, Dr. Parvez Grant, and Mr. Praveen Agarwal. I met him for the first time today, Mr. Agarwal. And really, I'm very thankful for the generosity that your foundation has made. We've had very sick children transplanted with your funding. And I've not seen many people like you actually, who've been so generous and continue to support. You told, I think Mr. Grant today in front of me, I will support if you start a pediatric program here and allocate a floor for that. And I want to promise all of you here that I'm very keen to support a pediatric liver transplant program at Ruby Hall. And I hope that will be one of the best in Maharashtra, I have no doubt about it, because pediatric transplantation has been my interest. I want to say all of you how overwhelmed I was this morning. When I came here, I visited Ruby Hall almost 9 years ago, I think, or 8 years ago. And I don't recall a lot of Ruby Hall. I don't know why, but today I felt that the support that the staff were giving to the program was really overwhelming. We had this inauguration and there were a lot of people there, a lot of nurses there, and we also know how to gather crowd for functions like that. But you had all of the consultants and they were so enthusiastic to be there. I don't think you can make it up. I think it was really real that the enthusiasm they had was visible to me. And that really made me feel so good. And it makes me feel that there is no way, I have to make it successful here. And the need is there. Everybody knows the need is there. The clinic is a classical example. They told me that there may be about 20 patients and 25 patients, and when I had seen 25 patients, there are 10 more, and I had seen the 10 more, they said there is a 10 more. It just went on and on and on. So the need is there in this part of the world, and in Maharashtra, you need a large liver transplant program. I have to say there isn't, compared to Delhi and in the South Chennai, you don't have such a big program for liver transplantation. And I think I've chosen the best place to work with and to collaborate with. And I'm so happy. Everything is in place. You've already done 100 transplants. Coming to today, I want to say, I don't know, we are already late. I'll try and do 20 minutes of my journey. Some people said, why don't you talk about your journey? And I want to talk about your journey only to tell you that you can be a very ordinary person and achieve a lot, because I don't regard myself as anybody outstanding. I was a good student. I don't want to underplay it. I think I stood first in my undergraduate days, and I stood first in the school I went to. But I didn't feel that I was special. I think if I say that, suddenly it comes to my mind. I think one of my classmates described me as nondescript. I think it was meant to be an insult for me, but that's how I felt I was. I was a nondescript personality. But now I'm so overwhelmed. The introduction was also overwhelmed me, really. And sometimes I feel I don't deserve all of this. Now, I went into a field. I was lucky to go into a field. I went to England actually as a frustrated surgeon, not feeling successful with what I did, but now I feel I went into a field which became a success in the last 20, 30 years. A new field, and today you can expect, really, we've done, since coming to India, I think this was until March 2018, I think I've done 2,000 liver transplants. Our program has done 2,000 liver transplants in the last 10 years. You can expect 90% survival. There's a 1-year survival for adults, and almost 92% survival for children over a large number of patients. This is possible in India. And I was coming to India for many years before settling back here, when there was a huge struggle about making transplantation a success story. And I've always said it will come and things will improve. You've heard I started from Stanley. I've always dreamt of becoming a surgeon, and after finishing my MBBS, I didn't get an MS seat for 2 years. I was doing a senior house surgeoncy, got very depressed, and that was a moment which made me feel India is not for me, I have to go out. The moment I decided that I wanted to go to the UK, I got an MS seat, and I completed it, and then left for UK, and went to UK, and UK, I mean, it's not been an easy life. I was a middle grade registrar, I finished my MS and went there, did my fellowship immediately after reaching there. Within 6 months, I got my FRCS. There was no MRCS those days, so it was an FRCS straight away. I worked in plastic surgery. I worked in vascular surgery for 2 years. I wanted to be a urologist and tried to get the best urology job, never achieved it. So I wasn't very successful in my career for 6 years. So I did many specialist registrar jobs. I think that's probably made me, the experience in vascular surgery and all of that has made me what I am today. And finally, when I went to King's, there was a senior lecturer who interviewed me, and it's not uncommon when you go to these registrar interviews in the UK for them to say, oh, you've been well trained, what are you still doing here? Why don't you go back to India and contribute there? I mean, I felt that those days as an insult. I mean, I've even had situations when I was appointed as a full-time consultant in King's, and I'll go to meetings and they'll say, what do you do? I say, I do liver transplantation. And they'll say, I didn't know you did liver transplantation in India. It was difficult for people to accept that I was a full-time consultant in a teaching hospital in London. So that's how things were, and that's how people were. So when I went to this interview as a senior registrar, they said, oh, why don't you try liver? Because they're taking on people from India, because nobody is interested in liver. This was 1989, 1990. So I joined in King's in the end of 1980. So I've been doing liver transplantation for the last 28 years. So when I went into a very premier institution, and really liver transplantation started in 1963, and the first 10 transplants died. In fact, the first transplant ever done by Thomas Starzl. We heard Mr. Agarwal talk about Thomas Starzl. From talking to you, I understand you've got a personal friendship with him. And I've had an opportunity to interact with him many times, and similarly in the European world, it was Roy Kahn who really brought about liver transplantation. He introduced actually cyclosporine for transplantation. It was Roy Kahn. And there I am with Thomas Starzl himself when I was younger. This picture was probably taken 20 years ago. And that is his grandson, Thomas Starzl's grandson. In fact, Thomas Starzl's son married an Indian woman. So that's a mixed race. So there is some India in that family too at the end of the day. And I've had an opportunity to work with many great people, I think. One was Professor Ott, who introduced pediatric transplantation to me. He was the man who did the largest number of pediatric transplants in Europe. And when he retired, and the interest in split liver transplantation, I had an interest in splits, and he had an interest in split. And when he retired, for his retirement talk, they had a function where Thomas Starzl came as well for his retirement, because Thomas Starzl trained Professor Ott. And the topic of talking on split liver transplantation in that meeting was given to me. I was really amazed that was his favorite topic, and he gave it to me and said, you're the right person to give the talk on split liver transplantation. And transplantation has improved enormously. There is an era thing here, you can see. This is for pediatric liver transplantation. Every era, the survival has improved almost 8 to 10%. And today, we can expect more than 90% survival for liver transplantation, both for adults and children. So it was really a fascinating experience, because I grew up as wanting to do the most difficult of the operations, because I mean, I felt that I was technically able. I knew even in India I was technically able. And liver transplantation offered that ability to do one of the most difficult operations. I do believe that in the human body, there is many think heart transplant may be the most difficult, but liver transplant is probably one of the most technically demanding surgery that you can do on a human being. And that requires really a team effort. I think without the team effort, which is why I think it wasn't so successful in India to begin with, because we are very good with working as talented individuals, but we are not very good with working many people together. And liver transplantation is an area which requires many, many specialties working together in order to make it successful. The intensive care, the hepatologists, the surgeons. I think we are probably now learning to work together with each other and making liver transplantation successful. So that was really, I went in 1999, so I was a registrar, a senior registrar, and I very rapidly became a consultant really in the UK. I became a consultant when I was 34 years of age, which was actually as good as any local person. I mean, younger than many local people who became consultants. And this was a foreign trained guy who went to the UK and became a consultant in a teaching hospital in London. Wasn't a very easy task to do. And in 10 years' time, I was made professor of liver surgery. I say this because everybody sees me as somebody who's pushed transplantation, but I had a gentleman who was the head of liver transplantation in King's. I was never the head of liver transplantation in King's. So therefore, I had to settle with the title of professor of liver surgery. And I did push the field of liver surgery and pancreatic surgery as well. And there are many moments where you have to prove yourself to become who you are in the Western world. I'm in a teaching hospital as an outsider, really, who did not train in the UK, who did not do undergraduation in the UK. And there were many instances, that's what I say, when opportunities knocks, you need to take it. You may have to take some risks. So this was, I don't know, many of you may not be, I don't know, most of you are doctors here. This was a patient who had a tumor, which most people would say is unresectable. Even today, any liver surgeons looking at it would say this was unresectable. And these were the very early days of really liver surgery. And this was referred to me by a professor in Great Ormond Street. This is a child, this is a girl, young girl, as for transplantation, and nothing else can be done. And he was somebody who was extremely powerful. And he says something and we have to do it. And I didn't have the guts to say, I can resect this tumor. There is no need for transplantation for this child. So I listed this child for transplantation and had a backup of another child and started this operation earlier, took the liver out, and on the bench took the tumor out, and then implanted the liver back in auto transplantation. These were the very early days of transplantation. So it was the ability to transplant which allowed me to resect a tumor without performing transplantation. I think it is this sort of really the bold step which made people recognize me as somebody who was able to outperform most of the surgeons of the day. So that is how really I made my mark in the field of liver, at least made my mark within my colleagues and the friends and the management of King's College Hospital. And there are a few incidences like that, and then I took on an interest in split liver transplantation because there was always a shortage of organs. And these were the early days. I was involved when the split process was discussed and how the techniques have to be described. And Europe was pushing split liver transplants. And in the UK, I was the one pushing split liver transplants, dividing a cadaver liver into two and implanting the left lateral segment to a child, giving the right lobe to an adult, which instantly doubled the number of organs. These are the days before the days of living donor liver transplantation. We are talking about 25 years ago that these techniques were developed. And we have written many articles. This is 1997, this is 20 years ago, as published as a possibility. And we published the first experience, I published the first experience of split liver transplantation. And you can see there were many more publications above. And that is my publication, present series, had the best survival, actually, at that time. Which very clearly sees, the point about promoting this in the Western world is, when you are actually dividing a liver into two, the technical complications is much higher. And patients will refuse to accept the organ when there is an option of having a whole organ, because the whole organ is actually allocated to them. Unless you can prove that you can produce equivalent result with half a liver, it's impossible to get an informed consent from the patient. So if you look at all of the single study, other than if you look at the combined European study as well, they all had something like 50 to 70% survival figures. So that is impossible to promote to patients, because we are saying you'll get a 90% survival with a whole liver, and with half a liver you get a 70% survival. Nobody's going to accept it. We were the first people who were able to demonstrate that there was an equivalent survival with split liver transplantation. And that's one of the reasons we were able to develop it very rapidly into large numbers. And so really in children again, we were able to produce something like 7-8 years survival of 85% in children. And from then on, really, my interest went on to transplanting the small children, because then we had a large experience after splitting to do children, pediatric liver transplantation. And when I went to King's, this publication is again something like 1997, 25 years ago this is. Is it 25 years ago? No, 22 years, 21 years ago. I found that the survival of the very small babies under 3 months of age is very, very low. Almost 50% of these children died. And most of the reason for that is even the small liver that we take out from adults proved to be very large for these children. So this is almost like a 1-month-old child. And when we put the left lateral segment of an adult, you can't close the abdomen. It's too large. They had too many complications. So it was really a touch and go. 50-50 survival was what we were achieving. And then I took an interest. This is a newborn baby, 15 days old. This is not the 5 days old baby. 15 days old baby who had liver failure. You can see how bloated this child is. And this is the size of the liver you take out. There is no way you will get a left lateral segment of this size. You actually need a 100-gram liver to transplant these children. And if you put a whole liver, that's it. So for the first time, we described what is called a monosegment transplant. The liver's got 10 segments, and we were using the left lateral segment, which is a combination of 2 segments. And this was the first time you had a description of a technique. There was one case report before that, where you could actually improve the survival of these children tremendously. You see here, there are 6 children performed now, with only 1 mortality, almost 85% survival. This is really a 1-year survival. And this is again 20 years ago. We're talking about newborn babies transplantation, 20 years ago with 85% survival. So we could really achieve outstanding results by further reducing a left lateral segment into a very small segment and then transplanting these children. And even then, these livers could be quite large. You can see the size of my hand to the size of the abdominal cavity, how small these babies are. This is probably, again, less than 1 month old. And really, I did some work with this Japanese surgeon. This is me those days. I think I look less fashionable those days than, I don't know if you think I'm looking more fashionable now. And he is also done, he was our trainee at that time. And today he's probably one of the most pioneering pediatric liver transplant surgeons in Japan. And this has come from really ideas and discussions we have had in our very early formative years about safe transplantation of newborn infants. And that's how this thing came about, your Guinness Book of World Records you talk about. This is an Irish family where they lost 2 children after birth to liver failure for a condition called congenital hemochromatosis, but they had 1 child who did well. This child is now a doctor. The older child is now a doctor. This is the child who had the transplant, and that's the child 5 years later growing up. And that's the same child, 22 years of age, who's a law student in Ireland now. So she's never had a CT scan after her liver transplant when I asked her. She's never had investigations. She's completely normal. When we asked, why haven't you had any investigations? He says, why should I? We don't even know how that monosegment looks inside her. I would be curious to have a CT scan just to see what that liver looks like when we transplanted her when she was 5 days of age. So really, that's how we have pioneered auxiliary liver transplants, and this is something which is very relevant to India. For acute liver failure, we are the only center who does auxiliary liver transplant. This is a rare operation, maybe technically more demanding. I mean, we've always, I think in King's, my colleagues and I have always chosen difficult things to do. And here you see an acute liver failure liver where there are some regenerating nodules. It's not a cirrhotic liver. If you can support this patient with good support by artificial liver or something, which have not been still successful, you could actually escape transplantation. So what we did what is called an auxiliary liver transplant, where we only took half of the liver and transplanted half of the liver and allowed the native liver to regenerate, and then stopped immunosuppression and took the graft out. So they don't have to be on lifelong immunosuppression. So we've had a very large experience, I think. So far in King's, we've done almost 100 liver transplants like that. So this is how it looks. You take half a liver and implant half a liver into them. And this is what happens to them over the next 12 months to 18 months. The first CT you see immediately after transplant, the graft is bigger, native liver is smaller, and this is a HIDA scan which shows 100% of the function coming from the graft, no function in the native liver. With time, the native liver starts to wake up, regenerating. 6 months' time, there is an equal function in the native liver and the graft, and then you start withdrawing immunosuppression. The graft rejects, native liver is fully grown, and you can stop immunosuppression. And this would be very useful for children with acute liver failure because they don't need lifelong immunosuppression. And the cost of immunosuppression is gone. The long-term complications of immunosuppression is gone. Again, this is something we've been promoting heavily, but not being very popular. And we publish extensively. I mean, this is all, most of these publications we were able to publish in very high-impact journals. This is from Annals of Surgery, again, almost 18 years ago. This is. So we've been able to do really very pioneering work in the field because it was a new field. And now I think it's not so new anymore. And again, for metabolic liver disease, we do auxiliary liver transplant. And this work we do now in Chennai, and it's become a very exciting possibility now. This is a child with metabolic liver disease, Crigler-Najjar syndrome. We do an auxiliary. The reason why we do auxiliary here is when there is going to be gene therapy. We've been talking about gene therapy for the last 20 years. It's not come up yet. I still say these are children. Gene therapy might come in another 10 years, 20 years, or maybe after I'm dead and gone, when gene therapy comes, the patients have their own liver. So I don't want to take that liver away from these children. And you do an auxiliary, and that corrects the underlying metabolic liver disease, and we have had publications to demonstrate that. And what happens now, I'll tell you I'll go into my movement to India and then what happens. So the reason for moving to India is really to work on further innovations. And living donor liver transplantation was an exciting area for me, and it was only happening in the Eastern countries. In London, we were doing 200 transplants, only around 10-15 of them were living donor. There is no way we could have become good with that technique working in the Western world. So when I really came to India, we worked on the science and art of really living donor liver transplantation. And that really is the most applicable thing in India. Here you see a child transforming in 1 month. This is 1 month difference after transplant. You won't believe that. The child looking so unwell, and it's just transformed 1 month later. And we practice everything from monosegmental transplantation. We have had patients come from far away, airlifted, this child was airlifted and had an auxiliary liver transplant, and presumably now coming off immunosuppression. The application of the auxiliary, this is a very interesting experiment we did, where this was done in Chennai and published in Liver Transplantation Journal, where we talked about what is called a cross auxiliary. This is again our publication published in Transplantation. We took 2 patients with metabolic liver disease, both non-cirrhotic, one with Crigler-Najjar syndrome and one with propionic acidemia, and took half a liver from one patient and gave it to the other, and the other half from this patient and gave it to the other. And the propionic acidemia liver corrects the metabolic abnormality of Crigler-Najjar, and the Crigler-Najjar corrects the metabolic abnormality of propionic acidemia. So the metabolic abnormality of the two livers just cancels out each liver. And we did transplant without a donor organ. There was no living donor, there is no cadaver donor. You only need two compatible patients to share livers with each other, and they are cured of their metabolic abnormality. I think that's all I have to say, and this is what I've done when I was in Global Hospital, almost 1,887 transplant. We've been one of the largest centers in the world. We'll probably rank number 2 or number 3 in terms of number of pediatric transplants done in the world. In fact, King's College Hospital does less than us. There are only one Chinese center which does more than us in terms of pediatric liver transplantation. And I've had an interest in this, and there have been many patients. We provide a service for Sri Lankan children. A lot of them are funded by the government. Even in Tamil Nadu, we train people from all over the country, as well as from international surgeons who come and train, mainly Sudan and Middle Eastern surgeons come and train with us. Even Western surgeons very often come to us. We have had a surgeon from Barcelona. There is a surgeon from the United States who spent time with us. And I think it's about publicity, about success of liver transplantation, which makes it possible for us to do more and more. We got our health secretary to see how well patients do. And I'm lucky that Tamil Nadu government also fully funds local patients. So we don't need to come to Pravin Agarwal Foundation for transplanting Tamil Nadu children. But we get children from other states to come. Tamil Nadu government won't fund them. So the children sitting in the ground here, most of them have been funded by Tamil Nadu government. And for a health secretary to see that and see how well that looks, and then it becomes very easy to go to the government for any funding. So when we transplanted 200 children, we gathered some of the children and family together just to demonstrate to the government what they've done and that their money has been put to good use. And I would like you to see that with Pravin Agarwal Foundation as well. Well, and the government, I think Tamil Nadu government has been very nice to me. I think they've given me the Lifetime Achievement Award, as well as a DSC given by the late Chief Minister of Tamil Nadu. Many people said, you go to India, it's going to disappear, you won't be an academic surgeon anymore, you won't be able to publish. That's completely untrue. We have an animal lab, we do basic science research, we still publish 25 to 30 papers every year in high impact journals. And while I was in India, I was asked to write a chapter in Gray's Anatomy, not when I was in King's College Hospital. So I don't think, the last Gray's Anatomy, this is going to be the last paper published Gray's Anatomy. Everything is going to be electronic from now on, so I was fortunate to get a chapter into this. So it's going to stay forever in all libraries. So that was really fortunate. We run this program for teaching, really, and this is a very popular masterclass in liver disease. I would love for all of you to come. This year, the meeting is in February, end of February, 28th, I think, and the 1st of March. All of you are welcome to this meeting. It touches very basics of liver transplantation. It's well attended. I think last year we had 1,200 delegates. Almost a third of them were international delegates who come to this meeting. And now I moved into this new hospital, which is a 430-bedded hospital. It's a multi-specialty hospital, but our focus is actually transplantation. And as I said, I'm very grateful to my team who have supported me during the move. This is just the transplant team. We went out on a little weekend off. And I'm very proudly, I would like to say that when I moved from Global Hospital to my institution, 270 people came with me in one go. And I'm grateful for all of my colleagues and the staff who put their trust in me, because most people are afraid when you go to a new institution. They don't know whether it's going to be financially viable, what's going to happen to their life, is it better to stay back? But 270 people, and subsequently I think we have had 30, 40 people join us as well. They put the trust in me. I think it is that team. I didn't have to create a team once again after moving into a new place. It's that ability which made us really continue what we've been doing. And in the last, this is all 10 months, I think, 10 and a half months, in the new institute, we have done 234 liver transplants. So the numbers didn't drop in any way. And just to finish off, we did the youngest child in India to have a liver transplant at 1 month of age, actually a month ago. I mean, this is 3 months ago published. This is a baby with a metabolic liver disease who was comatose really with urea cycle defect. The child was actually transferred from Maharathtra. The child was airlifted from Maharathtra to Chennai and did a transplant, done extremely well. And this is our meeting really, Masterclass on Liver Disease, 28th to March 1st, and I welcome you all. And thank you very much for listening to me this time when we already have these things. And I apologize for arriving late, otherwise we could have finished much earlier. Thank you very much.
Sir, I would like you to stay on stage. On stage, please. I want you here. Just for a minute more. So, ladies and gentlemen, I think we are all struck by lightning. In the era we talk about artificial intelligence, robotics, I think we have learned basic things is the art of good surgery, humility and perseverance. He deserves a standing ovation. I think it's an honor for us to have Gray's Anatomy, the book none of us managed to read, to at least have somebody in our audience with us. I now would like, please have a seat, ladies and gentlemen. I would like to invite the team of Ruby Hall, the transplant team, which Dr. Rela has kindly decided to mentor. Manoj Sirvastav, a surgeon, who has been with Dr. Rela since 2012, has been a part of more than 200 liver transplant programs with Dr. Rela. Manoj is going to lead as a chief surgeon for the program. Dr. Vineet Shah, our hepatologist, a gastroenterologist from Gangaram, and also has worked with Vedanta and ILBS. Dr. Anuja Atle, our own student from surgery, has done a fellowship on liver transplant from King's College. Dr. Nitin Pai, our star gastroenterology and who wants to drive this even more better. Dr. Sahil Rasne, gastroenterologist, and has been a part of the transplant program at Mayo in Chennai. And Shrikant Kode, who joined us as a liver transplant anesthesiologist from Max Hospital. So, ladies and gentlemen, the team deserves a bigger applause. Together, please. And thank you all for staying so late. The dinner and the bar both are open. Vote of thanks that I'm giving it. I mean, I deserve it. I need more than 5 minutes. I would like to thank everybody for coming here today evening in spite of having it so late. I would like to thank especially Manisha, Dr. Pujari, Dr. Patare, Sachin, the MCure team, Alankar, Dr. Gulati for staying back so late, Parvez for being patient, the Agarwal family for extending their heartfelt generosity to us, and thank you all, ladies and gentlemen.
And of course, don't forget to thank the people who've been behind all this which you had today, and for you, Dr. Rela, especially for coming, Dr. Pujari, Dr. Sanjay Pathare, Dr. Rebecca, thank you all for helping out, and of course not to forget Sachin and his team who have done a magnificent job today, morning and night. Thank you.
So dinner is served, guys. The bar's been open for some time. Thank you.
Sanjay, come. Sir, come.
So, lot of can we just get in a little please? Okay, perfect. Ready? Thank you.
Thank you.